Good afternoon and hello. This is Michael Pepe. I am the Director of Solutions Engineering here at Cinzy. I appreciate everyone taking the time today to learn about our solution, and welcome to Cinzy's latest learning lab on how to manage the heart health of your patients with virtual care. We decided to do this as February is Heart Health Month. But for today's session, all participants will be muted, but please feel free to type any questions you have in the chat window, and I can answer any questions once we get done with the presentation today. So for any new folks, any new clients to the platform, it's really a comprehensive communications platform. But for today, we'll be focusing on managing the heart health of your patients. We'll walk through all the varieties of communication modalities you can use to manage and prevent heart conditions in your patients. So again, for anyone new to our company, we are a virtual care company based in St. Petersburg, Florida, and our platform allows staff members, patients, family, and community physicians, all on the right-hand side, to really communicate virtually and really to improve the quality of care and patient experience. Our platform is device agnostic, so staff, patients, and family members can use any device they are comfortable with. Even though we will be solely focusing on heart health and managing patients with heart conditions, as you can see, our platform offers a variety of communication modalities that you can essentially really target your entire patient population. And the ability to coordinate in the same conversation with all these folks on the right-hand side is a big key differentiator for us. And we're really one of the best in the industry in managing patients with complex chronic conditions. So today, when we do focus on patients with comorbidities or maybe a high-risk patient with CHF, we can really use the different modalities in the platform to effectively communicate with these folks. But no personal phone numbers or emails are ever shared from your staff members. And as administrators, you have complete transparency into all the video visits that take place on the platform, date and time stamp, and any of the communications that go out to the patient. All right, so as most of you know, CHF is a major focus for most agencies. The true meaning for virtual care is really to be a step ahead of a foreseeable problem that you might not have caught in person, gather data and monitor patients. So being proactive, not being reactive. And this is really when you're not with them and in between home visits. And also to proactively educate the patient and their family members is a very important part of the platform. So across our client base, big cause of concern for most of our clients is CHF, congestive heart failure. Number one cause for rehospitalization. As of a few years ago, rehospitalization rate is still very high, around 50% after 6 months post-hospital discharge. I believe I saw some number recently. It's about 20% within the first 30 days. So we're going to be focusing on mainly a CHF patient today and high-risk patients, but these methodologies that I'm going to show you can be used for any heart healthy program, such as maybe managing a patient with pre-hypertension or hypertension, right? That might be on the lower risk scale. So really not just for high-risk patients, can be used for the majority of your entire patient population. Really important that you look to stratify your patients from low risk to high risk to be able to place them in the appropriate program, assessment, and how you're going to effectively engage them. But as we go through the platform, I'll discuss how you could scale down these communications to manage your lower risk population. All right, so let's go ahead and flip over to the platform now. So within Cinzy's virtual care application, I'm currently logged in as a clinician and under the patient tab, but really two different ways that I can proactively gather data, monitor my patients, such as this one who might be a CHF patient. Maybe they're a new patient and just started them on their care plan. And I want to use our remote patient monitoring tool as well as assessments, which we'll talk about in a minute here. But really being able to proactively monitor your patients being able to look at captured vital signs such as blood pressure, oxygen levels, heart rate, temperature, weight, and glucose. But for this example, maybe you have a recent CHF patient on your roster. You might want to monitor their blood pressure, their oxygen levels, their heart rate, their weight. You can send reminders to that patient up to 4 times a day. We connect to Bluetooth low energy devices. So whether a patient or an agency picks up a Bluetooth blood pressure cuff, or maybe a pulse ox device or a Bluetooth scale, that patient or caregiver can easily pair that device to their application. And this is a very cost-effective means of monitoring patients in between visits. These types of devices, the price point is extremely low compared to some other vendors that do have proprietary devices or hardware that might lease out equipment. A patient can go on to Amazon, go on to Target, Best Buy, Walmart, any major retailer, pick up a $50 scale or a $20 blood pressure cuff in CVS or Walgreens, and pair that device directly to their application. So you're really able to monitor a wide range of patients, not just your patients with comorbidities or complex chronic conditions. So if you're, managing a lower risk patient that maybe just has slight hypertension, they can pick up a blood pressure cuff and go ahead and monitor those vitals on a daily basis, or however often you want to set up that cadence for that specific patient. Each automated reminder can be customized per patient, and we'll go through that in a minute. But everything is fully reportable. We'll end on the administrator side just so you can get a good sense of our remote patient monitoring reports. But as you can see, the blood pressure here is highlighted in yellow. So you can also set up alarm thresholds where if a patient exceeds a maximum reading that you have set or drops below a minimum reading, anyone on that patient's care team, so anyone at your organization, will be alerted via secure message, and then you can absolutely run reports off of that as well. So we'll come back to remote patient monitoring once we get over to the patient-facing application. Another way to actively monitor patients and gather data is our assessment tool. Very powerful to couple up with the remote patient monitoring, and we'll talk about patient programs here in a minute. But this allows you to build a configurable survey. You can pull from our assessment library. You can configure your own assessments. And these can be set up to go out recurring as well. So, let's just say Jerry Doyle here is a CHF patient of mine, and I want a recurring CHF condition survey to go out to him every other day, every day at 8 a.m. It could be questions such as, did you weigh yourself today? Yes or no? What is your weight? Right? So maybe that patient might not have a Bluetooth type of scale yet, right? You're still able to gather that type of data. You're able to flag responses as well. So if my patient responded, no, they didn't weigh themselves today, and I know they're a very high-risk patient, I'll be an automated alert will pop up directly in my secure messages, and we'll walk through that. So those are really the proactive automated ways to gather data. We do have some on-demand communication. So our on-demand communication side plus our automated communication side. So I have the ability to securely message the patient, text, email, as well as a video visit, right? So if I need to have some sort of PHI sensitive conversation with this patient, as you could see here, I noticed Jerry, he responded on his assessment that he's reporting a new symptom, such as shortness of breath. I know Jerry has a pulse ox device. I might have given that to him. It could be a Bluetooth type of device, or maybe it's a non-Bluetooth type of device. I could tell Jerry, go ahead and take your latest oxygen level reading and heart rate. And as you can see, Jerry snapped a picture, was able to send it to me securely. This is not over text message, this is through the application. So as a clinician, I can have those encrypted type of conversations, not worry about any sort of compliance. And if I maybe want to save that picture or edit it and crop it, I could save this picture for Jerry and then upload it in my EHR in a note for later. So as I mentioned, we do have the video visit, right? If it's some type of urgent situation and you do want to hop on a virtual visit with Jerry, you have the ability to send him a text message, or you can begin a video visit directly through the application. Okay, so we have both the ability, which we call click to call, where the patient does not need to download an application, or through the application. Maybe you have a patient that might just have a flip phone or a non-type of smartphone, or you just want to have non-PHI type of communication. Depending upon the patient's preference here, whether they chose email or text, by selecting this envelope, you could begin a text message or an email conversation. You can also pull from any pre-saved template as well. So, let's just say I know Jerry Doyle here. He hasn't been taking his medications lately. I just saw him at home yesterday. Maybe I want to send him a quick reminder. I can pull from a pre-saved template without having to free type that message in and save my staff time. So, very important part besides gathering data when you're not with the patient is being able to educate that patient and their family members, if they're involved, or another caregiver, is with our automated programs. Okay, so seen a lot of success across the country with our client base that have been using this tool with chronic conditions, whether it's simple education as reducing sodium intake, or if you are reporting any new symptoms, here's the number to call. But that's what our clinical pathways and our patient program management takes care of. It allows that patient to read any information about their condition. So for instance, I have this patient enrolled in a variety of programs, but for instance, this CHF Care Pathway 60 Days is an automated 60-day program. They're going to receive messages via whichever preference they selected here. And like I mentioned earlier, they could be things like medication reminders, or, if you are short of breath or experiencing any of these new symptoms, please reach out to us. Here's the number. But very important that you're pushing education, you're managing the patient's current condition, and you're giving them the most up-to-date information they need to improve their lifestyle. So 2 last parts about the clinician managing the patients is care teams and caregivers. Care teams are very important for high-risk patients. So, if my patient, Jerry Doyle here, imagine he's a CHF patient again, I can have a pre-designated care team, and care teams are just automated, pre-built out individuals at your organization that could be assigned on a patient-by-patient basis. So care team doesn't need to be assigned for every patient. Maybe you have a group of low-risk patients that you do not want to assign a care team. The care team allows the patient to initiate communication with your staff. So whether it's a virtual visit or a secure message, they'll have that ability. Really important for your high-risk patients to be able to give them that access. Instead of picking up the phone, calling 911 at the slightest concern, they can reach out to pre-designated staff at your organization. And we've seen that really reduce rehospitalization. You might have heard me say earlier that you can really use Synzi for the majority of your patient population. Very common question that I typically hear is, maybe an older patient with chronic conditions might not have the ability to get to a phone or a smart device or a tablet or a computer. Even if you never are going to communicate with the patient, it's very important to have the patient built in the Synzi. You might not ever have a direct video visit with that patient or a secure message or text or email, but utilizing our caregivers gives you the ability to communicate with that patient. And caregivers we use very broadly within Synzi. So as you can see in this example, it could be a family member. It could be an outside community physician. It could be a neighbor down the street. In this instance, Sam Doyle is Jerry's son. He's one of Jerry's caregivers. He actually lives with Jerry, or he could live down the street or next door from him. And I can simply text or email Sam here asking if I could do a virtual visit with his father. I also have that secure message as well too. Another important point of managing chronic conditions in our platform is we give staff members the ability to remove a lot of work from them and make their jobs easier. So Sam might want to be included in all the messages that Jerry's going to receive, whether it's education on medication reminders or his condition, because he knows Jerry doesn't have a device, or maybe Jerry doesn't look at his email or his text messages often. So Jerry's son wants to be included in that. So all I have to do as a staff member is flag the caregiver, and now they're going to receive all those same automated communications and education that the patient's going to receive. And that's a pretty powerful use case, because we see a lot of our patients within our platform have a caregiver attached. This saves a lot of time for your staff, who a family member. I heard a ton of stories of a nurse maybe going to visit a patient. Then they need to call up the family member afterwards, tell them how the visit went, what the plan of care is. This could all be done automated just by flagging that caregiver, and now they're going to receive all those automated communications that the patient would. All right, so let's take a look at the patient side of the platform. As I was mentioning earlier, with the remote patient monitoring, you can send reminders to that patient up to 4 times a day. So if they are a CHF patient and you want them to monitor their oxygen levels, their heart rate, their weight, their blood pressure, send those out by email or text message. Patient simply needs to click on the link, and it's going to bring them right to their application. So I'm now logged in as Jerry Doyle, and I'm just going ahead and mirror my iPhone right now so you can all see what this looks like. But from directly on here, I have a patient program message. So here's the first message of the first day of that CHF patient program that came in directly. So as you could see for my demo enterprise, a little bit more generic than what it would be in real life. But just to give you a good example, any new symptoms that you're experiencing, here's the number that you can call us directly, and here's the list of symptoms. So patient will get it via their preference, text or email, but it will also be in the application as well. Let's imagine that Jerry here is a patient that you're doing remote patient monitoring with. He might have in his settings a pulse ox device connected. He has a scale connected, maybe he connected a blood pressure cuff via Bluetooth as well. Jerry gets the reminder that you saw earlier. Jerry goes ahead, puts the pulse ox device on his finger, and we made it very simple for patients. They have to hit 2 buttons. They have to hit take reading and get reading. So in a second here, you'll see my oxygen level, 97%. And then once they're done, they hit confirm reading. So very quick and easy for them to place the device on them, whether it's the blood pressure cuff, pulse ox, or maybe step on a scale, hit take a reading and confirm a reading. Those results are then transmitted directly back to the patient profile and all the reports. Jerry is a CHF patient, and he has a CHF care team assigned to him. Maybe Jerry was a patient just with hypertension, maybe a lower risk patient that might not be a CHF patient. So if he did not have a care team assigned to him, this area would be blank. But for high risk patients that do have a care team here, as I mentioned, they have the ability to begin a secure message or begin a virtual visit. There doesn't need to be individual care team members assigned to this patient. There could be just a group that you have assigned. So it could be the first available nurse or whoever is triaging any sort of patient incoming calls or video visits that come in. But for a patient, all they simply need to do if they want to reach out to the first available nurse coach, they just go ahead and click on that button, and it's going to ring to the first available person. So very easy for the patient. They don't need to go ahead and look up a 1-800 number. They could do it all directly from the application. And then our assessments, pretty powerful with the remote patient monitoring as well. Patient can take this assessment outside of the application. They don't need to download an app for them. They could take it via text or email as well. But just to get a good sense of the assessment, configure what the assessment's about, what it's for, how long it's going to take the patient, and then configuring yes, no questions, multiple choice, or text boxes. So I'm going to go ahead and just fill this out real briefly for the patient. And I'm going to go ahead and enter my weight for today. Since I might not be a remote patient monitoring type of patient, I might not have a Bluetooth scale, I might need to manually enter my weight. And I'll just say I'm experiencing shortness of breath now. And I'll say while at rest. And I'll say no. Say yes, I do have questions and I would like a nurse to follow up with me. And as you can see, I completed the assessment. So really powerful tool for you to gather data very quickly on that patient. Back in the virtual care application, okay, I have specific responses flagged, as I mentioned earlier. So I'm Anita Singh, a part of Jerry's care team. I'm going to get any of these flagged responses as secure messages. So as you can see, these ones that just came in about 30 seconds ago, Jerry had responded to a couple questions that show up as interventions, mentioning, would you like a nurse to follow up with you? He responded yes. You can see several of the other ones. He's not taking his medications as prescribed. So I can quickly engage the patient from here by typing a secure message. Maybe I think it's urgent and I want to hop on a virtual visit with Jerry. I can do that directly. So really the immediate notification to your staff is what the assessments will give you. As an administrator, really in our enterprise admin section where the user management, clinical content management, and everything takes place, as well as reporting, is where administrators, directors can customize most of these communications that I just mentioned. Here is just on our back end, on our enterprise admin, of what that CHF program looks like. So just want to give everyone a good sense of what sort of customization you can do here. This was actually a program from one of our best practices from the American Heart Association. So like I mentioned, if you're currently in implementation or you're currently live on the Synzi platform, please reach out to your account manager. If you're not using our patient program management tool and want to see some programs from our content library, some folks might need a place just to get started, and you can absolutely build on top of our existing programs. But like I mentioned, this is an existing one from American Heart Association's recommendation. And as you can see, there's some medication adherence reminders, exercise reminders, dietary reminders, and this will go out over 60 days. So there's a fine line about being able to provide patients enough education and not wanting to bombard them with too many messages as well. So this program actually has a nice cadence, goes out every couple days within the first 20 days, which is a very important window. And as you get to the 30, 40, 50, 60-day mark, as you can see, there's a 10-day gap in between there. But really important for your high-risk patients, your CHF patients, the first 20 to 30 days, set up recurring assessments, monitor them directly with remote patient monitoring, and make sure you have a patient program in here, an automated program that's going to get them out all the pertinent information. And any of these patient programs as well, you can customize the date and time range. So you don't want to send any education to your patients on the weekend, and only between 9 a.m. to 5 p.m. you have the ability to do that. So what does that all do without not being able to get in and see all this data? We have many reports built in. This one is specifically a program compliance report. And you can run these specifically by your automated programs within Synzi's Enterprise Admin. This would be every single patient that's on the CHF Care Pathways program. So I only have one patient on this program, and as you can see, Jerry has not received any messages. That's why we have 100% out of compliance, right? But you'll be able to get a good sense across your entire patient population. If you're managing a group of CHF patients or a group of hypertension patients, how many of these patients are engaging? Is there any sort of action items within those messages that you're including? Or is it just information only, as you can see? And you can also get a good sense if that message was delivered and if there's any pending response. You also have the ability to drill down into specific patients. So for this one, for Jerry Doyle, I can see every single program that he's enrolled in. I can see a CHF program, his vitals program as well. And then I can see any of the messages that are pending that are going out to him. This is really the full patient activity for all those automated programs. On the assessment side, the ability to drill down into these results as well. So just like the automated programs, I can see the compliance rate. On the assessment side, I can see every single patient that's taken my CHF assessment, see the response rate, see how many are incomplete or complete, start to get good transparency into how my patient population is responding. If I have a lot of patients that are not compliant with maybe taking their weight or engaging in a specific way, I can really use this data to engage them in a different way. And again, of course, you can drill down into a specific patient to find that patient's assessment responses. So you saw the automated responses that come in to the care team. This would be more for an administrator or director if they wanted to pull up that patient's individual responses. We also have an interventions area. So this is an area where there's any sort of abnormal responses, right? So any responses that have been flagged. I can view these across my entire patient population, and really gives me a checks and balances area that I can make sure all my patients are being responded to and are being handled in a timely manner. And I can absolutely message them directly from the report as well. So if I know a patient didn't answer no to a specific question in an assessment, I can type them a message directly from here. So really just to end on a remote patient monitoring area, which is an area that's gaining a lot of traction across our client base using those Bluetooth type of devices. We give you a command center dashboard as soon as you come into the enterprise admin area for remote monitoring. Administrators can come in, see all the patients that have missed readings for the day. So any of your patients with chronic conditions like CHF, if you know you had a group of patients that needed to be weighing themselves every morning at 8 a.m., you can quickly see who's missed the reading. You can see who's out of compliance or in compliance, and then view the response times directly. Again, going back to assessment results and patient program results, you might want to drill down into a specific patient and see their latest vitals over a specific time frame. So you have the ability to customize the date range on where you want to view those vitals. You might be working with a physician outside of your agency that might want to see the patient's vitals for the past month, their oxygen levels. You have the ability, you can tell your referral sources that, any physicians that you're working with, I have the ability to pull this data and send this directly to you. But you'll get dropped in an interactive dashboard here. And so let's just say, I'm monitoring this patient's oxygen levels. Any graph, I could start to see trending here. It's an interactive dashboard. And then if I do need to export this data out of here, I can. And then just lastly, you might want to monitor any patients that have abnormal results. Okay, so really an area where you can see someone that goes above that maximum or goes below that minimum threshold that you have sent. So, for oxygen levels, I had sent this pretty low the last time, or pretty high, excuse me, the last time I set it to 95% for this specific patient. So their previous reading was 95 and now their current reading is 98. So I can see both right there, what the vital reading is for. And then just like the assessment report in the intervention area, you might have a specific nurse that's dedicated to remote patient monitoring, or an administrator or a director. They can come in here on a daily basis, on a weekly basis. This data comes in at real time. And once a patient completes that vital reading, if it's abnormal, it's going to come directly into this report. They have that same ability to message the patient directly here. So I'd like to thank everyone for their time today. Hope some concepts that might be new to you resonated. Really powerful when you're coupling up the different functionality within our platform, whether it's patient program management, assessments, remote patient monitoring. We've seen a lot of success when clients use all those different modalities in conjunction with each other. So very powerful virtual visits on its own and secure messaging and pushing out patient programs. But if you're managing patients with complex chronic conditions, the ability to communicate with those patients in a variety of ways and see how they respond to get the best result has really yielded a lot of good responses for us. So thank you for everyone's time. If anyone has any questions after the webinar or after they watch this video, please reach out to your Synzi account manager or implementation team to implement any of these new strategies or discuss how this would best fit your organization. And thank you. Hope everyone has a great rest of the week.